Congress is making slow progress on the Republican replacement for Obamacare. Foot dragging by Democrats kept two House committees in session throughout the night. Some members struggled to even stay awake. The Ways and Means Committee did approve a key provision at 4:30 a.m. Eastern Time.
Democrats and some Republicans criticized the bill, and influential medical and lobbying groups are lining up against it. They include the AARP with its nearly 38 million members. House Speaker Paul Ryan says the plan delivers on a long-standing promise to repeal Obamacare.
House Majority Leader Kevin McCarthy is working with Speaker Ryan to sell the Obamacare replacement to his fellow Republicans. The California congressman is with us now from Capitol Hill. Congressman McCarthy, good morning.
Good morning. How are you?
I'm good. You weren't up all night, were you?
No, I'm not on Energy or Commerce or Ways and Means, but Energy and Commerce is still going as we speak.
That we showed a live shot of them earlier working through the night. Though, let me ask you this. Now that you have just about every major influential group coming out against this, meaning the hospitals, the doctors, the nurses, AARP, are you confident this can get through Congress before April 7th when Congress goes on recess?
Yes, very confident. And remember, this is one of three phases to repeal and replace Obamacare. This is the first phase going through. And you have to think about, why are we currently where we are and why are we repealing it? Remember what Obamacare did. It did three essential things. It gave greater control of health care to the federal government. It was the exchanges, and then it was the expansion of Medicaid. Neither of those on the past. When you look at the exchanges today, in 1/3 of all the counties of America, there's only one provider. Humana was recently pulled out. That gives 16 counties in Tennessee with no provider. And Medicaid is on a path of destruction. It's going to cost $1 trillion within the next 10 years for 1 year, and that's the equivalent of how much we spend on discretionary spending for all of government. So you can't let this go forward. It's going to collapse upon itself. We have to solve the problem. And this is the first phase, and it's going through reconciliation, which makes it, with the Senate rules, a little more difficult. Then the second phase will be with Tom Price and Health and Human Service Secretary. And the third phase, we'll start moving at the same time, those bills that take 60 votes. And overall, you'll have a very good bill that solves the problem, that lowers premiums price and greater quality to health care.
But Congressman, the hospital associations that Norah mentioned are warning that this will result in a substantial reduction in the number of Americans who are covered. Do you disagree with that?
Yes, I disagree with that, because if you want to sit back and say the argument that the federal government is going to mandate that everyone gets covered, look for of what has taken place today. If people can't get care, Obamacare created 23 co-ops and provided more than $2 billion. In this short amount of time, 18 of those co-ops have collapsed. If you have 16 counties in Tennessee that don't even provide any coverage at all, how can that provide coverage to them? And then you look at what the providers are actually saying. They're calling it a death spiral when it comes to Obamacare. We can't sit back and see people go without health care. We brought to provide a system that would actually lower the price and bring greater quality.
Congressman, this is all happening remarkably fast. Your colleague in the Senate, Tom Cotton, tweeted some guidance to you this morning saying House health care bill can't pass Senate without major changes. To my friends in the House, pause, start over, get it right, don't get it fast. Will you heed that advice?
We have heeded that advice. We have spent the last 6 years studying the Obamacare and the failures of it. We have sat back and watched this thing get collapsed. So what we are doing are keeping the promise of what we said we would do. We will repeal Obamacare and we will replace it. Unfortunately, we have to do it in 3 phases. And under the rules of the Senate does not allow us to give a full replacement in one simple vote. So that's the reason why we're going through 3 different phases. We're going through regular order as you watch through committee, through Energy and Commerce, through Ways and Means, and then it will go next week to budget, then come to the floor. This is the way legislation is produced in America. This is the way that, one, we could actually keep the promise to lower the price of health care.
I know that President Trump is taking an active role in lobbying some of the more conservative members of your caucus who oppose this bill, particularly the tax credits, who they call an additional entitlement, bringing some of them to bowling tonight at the White House. Is that going to work?
Well, look, President Trump supports this bill because he understands that it lowers the price. But what's more importantly, tax credits is a conservative idea. If you look back to what Heritage said in 2007, it says tax credits are the way to provide greater health care in the process. So I believe when people sit and read this bill and understand that this is phase one in a process, you're going to find much more support as we go through.
All right, Congressman McCarthy, thank you very much for joining us this morning.
Thank you for having me.